Meet Steve, who spent 20 years puzzled by a peculiar problem, an excruciating shoulder pain that appeared only after he ate. What he didn't realize was that this strange symptom had a surprising secret waiting to be uncovered. Join me in solving this pain mystery today. Steve was in his early 30s when he noticed a strange pain on the top of his left shoulder. The pain only occurred after eating. The pain was vague and always has a deep, boring type of discomfort that was poorly localized to the region deep to the back of his left shoulder and also affected the upper fibers of his trapezius area. When the pain occurred, he tried moving the shoulder position or doing a massage of these regions, but none of this alleviated his pain. He tried analgesics, ibuprofen, acetaminophen, but they never did anything to the severity and intensity of his pain. He also tried changing positions, but the pain was not changed. The pain started immediately after eating heavy meals and always disappeared approximately 30 minutes later. There was no association between the type of food and the eating time. None of this had any influence on the intensity or duration of his pain. He is 52 years old and showed up for a medical examination to see what was going on with his shoulder. The doctor asked about his past medical history, and the only medical condition he has included high cholesterol. He had no history of surgery. The doctor asked about his family medical history, and he mentioned that both his parents have high blood pressure and are adequately treated with medications. The doctor examined, and he had normal neurological examination, normal heart, lung, and abdominal exams. Also, the examination of his head, neck, and shoulders were all normal. The most likely hypothesis was referred pain from the diaphragm muscle. This is a large muscle that separates the chest from the abdomen. It is vital for respiration. Moving downwards creates negative pressure in the thoracic box that pulls the air into the lungs. And when it moves upwards, it expels the air in the lungs. This large muscle is innervated by the phrenic nerve, a long nerve that starts in the cervical spine from the 3rd, 4th, and 5th cervical vertebra, or C3, C4, C5. The left and right phrenic nerves travel down through the neck and chest and pass the lungs and heart to reach the diaphragm muscle. The left phrenic nerve controls the left side of the diaphragm, while the right phrenic nerve controls the right side. It is known that irritation of the diaphragm muscle and phrenic nerve may cause referred pain in the shoulder. The structures above the diaphragm that may cause irritation of the phrenic nerve and lead to shoulder pain include pericarditis, lower lung pneumonia, and a type of lung cancer called Pancoast tumor. The structures below the diaphragm that may cause referred pain to the shoulder include stomach perforation, pancreatitis, and liver abscess. Therefore, CT scans of Steve's chest and abdomen were ordered. The results showed the absence of any disease in these regions. That was excellent news for Steve, but he had referred pain when his stomach was full to the left shoulder due to a left phrenic nerve irritation. But then Steve asked, what is referred pain? And how can I eliminate this pain? Referred pain is a very known type of pain. It occurs when discomfort is felt in a location different from its actual source due to shared nerve pathways. This type of pain often follows predictable patterns, such as arm pain during a heart attack. Unlike localized pain, referred pain tends to feel diffuse and difficult to pinpoint. It arises when nerves from various regions converge in the spinal cord or brain, causing the brain to misinterpret the source. Associated symptoms like nausea or organ-specific signs can provide important diagnostic clues. The precise mechanism of referred pain is not fully understood. Still, the predominant theory is that the nerve fibers from different areas converge to common areas in the spinal cord, resulting in misinterpretation of the location of the painful origin and the perception of pain in an area that is not affected. It is distant from the area of stimulation. But how are the stomach and shoulder connected? The phrenic nerve originates in the cervical vertebra 3, 4, and 5. The innervation of the skin over the upper shoulder area is also originated in the C3, 4, and 5. Now that Steve knows the cause of the pain, the best method to improve the pain is to retrain his pain system and re-educate his brain that the pain he feels is not a sign that something is seriously damaged in his shoulder. He doesn't need any physiotherapy, painkillers, or injections in the shoulder. He can be reassured that his pain is benign and is just a false alarm from a misinterpretation of the neurons in the region of the spinal cord around C3, C4, C5. Another strategy he can try is to avoid eating heavy meals and eat smaller portions throughout the day. Here are 5 key lessons from this case discussed in this article. First, referred pain is complex. Symptoms like shoulder pain after eating can originate from unexpected sources, demonstrating the complex conditions and connections within the body. 2. Importance of a detailed diagnosis. Like uncommon presentations require a detailed evaluation and an interdisciplinary input to uncover hidden conditions. 3. The role of gastrointestinal triggers. Digestive processes can produce symptoms in distant, seemingly unrelated areas, such as the shoulder. 4. Patient persistence matters. Chronic symptoms can take years to diagnose, emphasizing the need for perseverance and advocacy in healthcare. 5. Educating clinicians. Awareness of rare symptoms patterns can improve diagnostic accuracy and patient outcomes. This case report was published in 2022. Check the description of this video to access the full publication. I added a fictitious name because the patient's name was not mentioned in the original publication. If you like this video, consider subscribing to this channel. And if you're interested in learning more about brain retraining techniques, check my course on YouTube. Please remember that this video is not intended to provide medical advice. If you have a painful condition that needs proper diagnosis, consult your doctor. And if there is an emergency, call an ambulance or go to the nearest emergency department. This video is for educational purposes only.